Vaccine rollouts will be likely starting in the U.S. in a matter of days and not a moment too soon, with the nation breaking the daily record for COVID deaths for the second time in as many weeks. More than 3,000 people yesterday, making it one of the deadliest days in American history. The nation also saw new highs in hospitalizations and a 20% spike in new daily cases from 2 weeks before. And of course, the numbers are rising here in Massachusetts, too, with the largest daily increase in deaths since late May this week, and an average of nearly 5,000 new cases a day. That's why, as we told you, Governor Charlie Baker is introducing new restrictions set to take effect on Sunday, which include tightened rules at restaurants where only 6 people will be allowed per table, plus a 90-minute seating limit. Masks will also be required of everyone at all times except when eating or drinking. But for some, the governor didn't go far enough, including the Boston Globe editorial board, which argued this week that indoor dining isn't worth it. Of course, not everyone agrees. And I'm joined now by people on both sides of what's becoming an increasingly important debate. Christopher Myers is the co-owner of Myers & Chang and Flower Bakeries, which have both offered outdoor dining and takeout during the pandemic, but have kept indoor dining rooms closed. Steve DiFillippo is the man behind the Davio's restaurant group, which does offer indoor dining at several of its locations and just opened a new one in Texas. Steve is also a member of Governor Baker's Reopening Advisory Board. Steve, Christopher, good to see you both.
Nice to see you.
Nice to be here, Jim.
Thank you, Jim.
Steve, starting with you, you decided to continue indoor dining. Why?
Because it's safe. It's nothing safer. I mean, look at the website for the state. Less than 1% of people have gotten COVID from restaurants. I mean, 90% is from people's houses. 5% is from long-term living places. I mean, restaurants are incredibly safe. We're much safer than anywhere else you can go. I mean, you know, Jim, I just had a big birthday a couple of weeks ago, and if I felt it was unsafe, I wouldn't be open. I mean, I have hundreds of people here that I work with that, as you know, people have been with me for 30 years. If I felt it was unsafe, I would not be open. We are incredibly safe. Restaurants are the safest place that you can eat.
Christopher Myers, you and Joanne Chang reached a different conclusion for almost the exact opposite reasons. I believe the safety of your staff was your number one concern. Was that not the reason for your keeping indoors shut down?
Well, there's a variety of ways to look at this. First of all, I don't think there's any way Steve is not looking out for the safety of his staff. My God, I've known him for 30 some odd years and top 3 restaurateurs in the city. I mean, he knows what he's doing, and he knows how to read a newspaper and a CDC report as well as anybody else. Well, it's not even a however. I want to advocate for my industry as much as the next guy. Myers & Chang, for instance, is just too small. The mise en scène of the place requires that you pack people in there, and it's low ceilings, it's small. The place where the food is being cooked and generated from is right there. You feel it as soon as you walk in. It's not a super well ventilated place. So,
Christopher, if your space was not small like Myers & Chang, but was roughly the same size as Steve's in downtown Boston, would you be open indoor dining?
It's funny. I almost took that space. The ceilings are colossal. They're seating properly.
So what's the answer?
Here's the other factor that I didn't talk
What's the
about
answer? What's the answer?
Let me say, there's an expression. All politics is local. All business is personal. I can't say right now I'm not in that situation. I know that my 83-year-old in-laws are staying with me, and I had cancer surgery 6 months ago. So the way I'm thinking is different a little bit, but I don't.
Yeah, but you take customers as you find them. You don't get to select which customers. Steve, I want to go back to you. Did you see the thing in the New York Times the other day? The New York Times surveyed 700 top epidemiologists and said, what were your greatest concerns? Number one concern of these 700 was a confined indoor space without masks, including restaurants. So am I missing something or no?
Well, Jim, I don't think they're looking at the data. I mean, so what does that mean?
Well, they are.
Go on the line and look at the state's public health data. Okay, it's very clear. I don't know, first of all, I've had death in my family. Karen's she's been on your show a couple weeks ago. Her husband, my brother-in-law died. I mean, no one's hit COVID more than I have. Okay, so, we've had hundreds of thousands of people that have eaten at Davio since mid-June. We haven't had one problem, not one complaint, not one person. Now, look at the numbers. We opened in mid-June all the way till October, no problem. Suddenly, we've had a spike. It's not from restaurants, guys. I mean, it's very clear. I don't understand. The Boston Globe, yesterday's paper, I thought was terrible journalism. I'm sorry. They did not use data. They did not look at the data that we have to look at. It's very clear. I don't know how many times I have to say it.
Okay. So, Christopher, the problem, someone's sitting at home right now and saying, these are two restaurants I really like. These are two guys who seem to be pretty sincere. What the hell am I supposed to do? One guy says it may not be safe for customers or staff. One guy says it's absolutely safe. So what conclusion do I draw as somebody who wants to eat good food and wants to stay healthy?
You're going to really hate my decision, my answer.
I'll let you know.
Call and get takeout from both of us. Here's the thing. CDC said something about aggregating in non-essential indoor spaces. I'd argue that keeping the restaurant community employed is as essential as it gets. It's a massive quotient of our country, and we're at the point now where places are closing down like dominoes. At the beginning of this, Jim, if you'll remember, we were selling books. Joanne was doing demos. Everything we were doing was going to pay our employees. We've run out of that money. That's gone, and everybody's at the point where they're losing money right now. So I'm not going to speak for somebody that has a big restaurant with high ceilings and lots of room. I'm going to say our staff didn't feel comfortable doing it in our spaces, so we're not doing it.
God, so let me interject a third person into this conversation who maybe does have the solution. Here's Anthony Fauci with Governor Cuomo on Monday. Listen to what he had to say.
When we were talking about what the best strategy would be, we would say something like, close the bars, keep the schools open is the best thing to do. So long as you subsidize and help the restaurateurs and the bar owners so that they don't go down and essentially crash because of the economic strain.
Now, if the state government, Steve, and the federal government hadn't taken a walk on helping restaurants and restaurant workers, which in my estimation both have, would you be willing to revisit your indoor decision, or would that not affect it?
Well, they did help us already, in the spring. I don't think any of us would have been able to reopen if they didn't help us.
You're talking about the PPP loans?
Yes.
They didn't do much for you, did they?
For me? They did, yes. Of course they did. Yeah,
they did.
They were very helpful. Oh, incredibly helpful. It's the first time Well, we hope that there's a plan. We're looking for the new plan. Unemployment ends in 2 weeks, Jim. I mean, we got a huge problem with this country. I mean, we're hoping the plan, the Congress comes back and helps us. By the way, Jim, have you been inside a restaurant since March?
Yeah.
Okay. How do you feel?
Not eating inside, going inside. I was actually inside your restaurant getting takeout maybe 2 weeks ago. Is that why you asked me?
Yeah, no, because it's not what it was back in March. Tables are 6 feet apart.
It was very different. I agree.
It's incredibly safe, and I'm really frustrated that for some reason, I don't know what it is, that we're the fall guy. By the way, Chris and I, him and I have been arguing since Linfield beat Newburyport in 1977. So, him and I will never agree on certain things, okay? But a little personal.
He's nodding in agreement. I think he remembers it like it was yesterday. Do you
feel
I
graduated in 76, so I really don't know what he's talking about.
Fine. Hey, Christopher, do you feel
I forgot how much older you are than me.
About the federal government, as Steve does? It seems to me that was yesterday's news. It's been almost 8 months since the federal government has done anything. The state government can't even cap these usurious delivery fees that make delivery more affordable or more profitable for people like you. Do you feel the government has been there for you, Christopher?
No, I mean at the beginning. I mean we got the PPP loan, and it was incredibly helpful for our employees. I mean we passed that along as much as we could. We paid our rent, and that was it.
When did that money disappear?
Fast.
When did that money disappear?
Literally maybe 75 days after we got it.
Right,
do we
exactly.
need more? Do we need more? There's no question about it. Let me say this again. Fauci suggested as much. Support your local restaurants as much as you can and walk there. Don't use the delivery services. Get off your butt. Get a little exercise in. Walk to the restaurant. Get takeout rather than delivery, because the usurious delivery fees are killing us. It's 18% on top of what our fees are. Plus you pay a delivery fee, plus most people tip. You're adding 30-something% to the dining, the cost of dining out, and the restaurants aren't seeing any of it. So
and it won't cost the state a penny.
Jim, I just want to say,
Steve.
Jim, can I say something? The governor and lieutenant governor, I love them. I think they're fantastic, but I look at them like my brother and sister. I don't always agree with them, especially my sister and her politics. But, they're doing the best they can. I mean, it's a tough situation right now, and it's going to be a long winter. We all know that. And we're all going to hopefully get some money from the federal government. We hope they extend unemployment. We hope it doesn't snow very much. I mean, we have a lot of hoping going on here. But dining inside is safe. I'm sorry. It's just, you got to look at the data. Did you look at the data today? Did you look at the public health from the state, from the website today? Did you look at it?
I looked at the survey from the 700 epidemiologists, and respectfully,
that's a no.
Steve,
Right.
I'm with them.
Okay,
But I will. How's that? I will,
and
you'll hear from me. I got to go.
I think you should. Okay.
The only thing I'd say as a coder
Steve
is
DiFillippo, Christopher, 10 seconds. What?
Nobody's forcing anybody to go out and eat in a restaurant. Am I? No, I'm not.
But I want a little guidance from my government. I don't want to be all on my own.
I mean, they're finally coming up with a more monolithic message than they've been carrying for the last many months since Trump's gotten out of the way. So thank God for that.
I got to go. Yep. Christopher, Steve,
right.
It's great to see you both. Good luck
Thank
to
you.
both of you. I really appreciate it. Take care.
All right. Thank you.